Hey squad, welcome back to the channel. On today's video, we expand our look on the pericardium of the heart and focus on two disease processes, pericarditis and pericardial effusions. If you guys missed last week's video where I detail the anatomy of the pericardial sac, check that video out by clicking the eye above my head right here. The word pericarditis can be broken down into three main parts. Peri, meaning around, cardi or heart, and itis or inflamed. In short, pericarditis is the inflammation of the tissues around the heart. This inflammation typically has an idiopathic or unknown origin. However, many times is caused by a viral, fungal, or bacterial infection. Other causes include kidney disease, HIV and AIDS, cancers, tuberculosis, after a myocardial infarction or heart attack, or it may be the result of autoimmune disorders such as lupus, scleroderma, and rheumatoid arthritis. Remember that there is a small amount of pericardial fluid in between the two serous layers of the pericardial sac. The 2 to 3 tablespoons of this clear to yellow-like fluid lubricates the heart while beating within the pericardial sac. As the inflammation increases, more and more fluid and other immune cells move from the capillaries to the serous layers of the pericardium, causing further inflammation. Over time, the inflammation overcomes this pericardial fluid, causing a rubbing action of the heart on the pericardial sac. This causes chest pain that most often is misdiagnosed by EMS providers as simple angina or possibly an MI. This chest pain often worsens with heavy breathing and can be somewhat alleviated by positioning your patient in an upright or leaned forward position. A fever can also be associated with pericarditis due to most often being associated with an infection. EMS providers should perform a routine cardiac assessment, ruling out MI as well as auscultating the chest just left of the sternum, listening for a friction rub to help identify pericarditis. This sound is created by the friction of the enlarged layers of the pericardium. It can be explosive at times and has a grating, scratching-like sound, almost like two pieces of dry leather rubbing together. Paramedics, while looking at their patient's EKG, should be on the lookout for several very specific changes associated with pericarditis. First, you will see ST segment elevations and PR interval depressions. Second, you may begin to see flattened T waves, which ultimately become inverted the longer the pericarditis goes untreated. Sadly, though, these changes are not always visible as the EKG will normalize even after the T waves have inverted, causing many providers to see a normal EKG and find no significant cause to their patient's chest pain. Remember that you must rule out other acute cardiac issues like MI and CHF as well. Both can cause angina. However, both have their distinct symptoms that will not present themselves or present differently when caused by pericarditis. Angina will not be changed via position and could be radiating to other areas of the body. Shortness of breath might present, but there will be clear lung sounds unlike the rales you might find in CHF. There is no treatment for this condition pre-hospitally. Treat the chest pain best you can. Ensure that oxygen saturations remain above 93% and that the patient has a perfusing blood pressure. Otherwise, get your patient to a hospital that has cardiac services. Now recall that 2 to 3 tablespoons of pericardial fluid within the serous layer. What happens when the inflammation persists and that fluid continues to build within the pericardial sac? We call this a pericardial effusion. This buildup of extra fluid can be secondary to pericarditis or can be secondary to lung cancer or some form of blunt or penetrating chest trauma. As this fluid accumulates, it begins to put pressure on the heart itself, creating a tamponading effect. Cardiac tamponade is a serious medical condition. I have outlined the symptoms of cardiac tamponade in an in-depth video that you guys can watch here by clicking this eye above my head. There is again no pre-hospital treatment for a pericardial effusion or cardiac tamponade. These patients need a hospital with specialized cardiac services to receive a pericardial centesis, a procedure where a long needle is placed into the pericardial sac, and fluid is taken to relieve the pressure on the heart. In some areas, air medical crews can perform a pre-hospital pericardial centesis on patients of cardiac arrest. Well guys, that's it for today. As always, stay safe out there, and I will see you in the next video.